This is Debbie Bucher for Parkland College, and this is the LPN to RN Transitions course. And today we are going to be going over Chapter 10, Teaching Patients and Their Families, from the text LPN to RN Transitions by Laura Claywell. This chapter talks about the principles of teaching and learning, including adult learning theory and tools to assess someone's readiness to learn. It also talks about how to evaluate the effectiveness of teaching and how to document patient education. And as we know, as a nurse, the education piece is a very important role of the registered nurse, and probably one of the biggest roles I think that I see us as registered nurses doing besides the actual physical care to our patients. And it is defined, our job as an RN is defined within the state nurse practice acts. Every state has their own nurse practice act, so you want to make sure that you're always following whatever state that you're in, that nurse practice act, very important. And the patient teaching is ultimately the RN's responsibility. And effective teaching can help empower the patient to better manage his or her own health care, as well as being able to make the best informed choices and decisions in their healthcare. So they really need to be educated well by the nurses and physicians, for that matter, so they can make the best informed decisions and choices. So hopefully they can have the best outcomes in their health. But they do need, it is true that patients need to be educated well with the education, but also with regards to their plan of care and what is taking place to make sure they understand it and that they agree to it. So as an LPN, your role in patient education was reinforcement of the education in the care plan. But now as an RN, you will be responsible for developing the care plan, including the education. And when you do the education with your patients and families and caregivers, you will have formal and informal teaching moments. And also you will also included in that, you will be doing discharge teaching, which is also very important for your patient to understand their role and what they need to be doing once they go home. But really all throughout your patient encounters, you are teaching really pretty much every time I think you have interaction with the patient, you are teaching them, with regards to something or some aspect of their plan of care. And again, the State Nurse Practice Acts and the Joint Commission set standards of practice expectations for nurses as teachers, as well as the Center for Medicare and Medicaid Services provides the accountability. So it is really important that our patients understand what they need to do for themselves when they go home, because I don't know if you are aware, but when patients are readmitted to the hospital for the same condition within a certain period of time, the hospital is not reimbursed for some care that is provided. So readmission to the hospital is a big problem. So, and in particularly at Carl, every new patient is screened for readmission. And hopefully set up with appropriate education resources to prevent readmission if at all possible. And included in that is the discharge teaching. So your role in that discharge teaching is very important, because hopefully with your education that you have done with the patient in the hospital, as well as the discharge teaching and education, the patient understands their medications, when and how to take them, as well as understanding their care, such as with regards to congestive heart failure. They know and understand their medications. They know they need to be doing daily weights and writing them down, and understanding that they need to be calling their care provider, usually if they have had a 2-pound weight gain or more in a 24-hour period. So very important. And also you want to make sure that you're getting education material to your patients. An example would be newly diagnosed diabetics receive a book explaining diabetes pathophysiology, signs and symptoms, treatment, and when to contact their provider. New medications are explained, including the indication, therapeutic effect, possible side effects to look for, and adverse reactions to call the provider for. They are usually given a glucometer and taught how to check their blood sugars, usually before meals and at bedtime. And then if they are prescribed insulin, then they are taught how to administer the insulin, which includes drawing up the insulin in a syringe, unless of course they get an insulin pen, which is usually quite a bit easier to do than what it is trying to draw an insulin out of a vial, although we teach many people how to do it. It's not a hard thing to do. They just need education. So, but at any rate, the RN is a very important critical role of being an RN teacher to our patients and caregivers. It's important that patients understand their plan of care so that they can empower themselves at home and prevent readmissions, and all the while meeting good outcomes and having a good quality of life. And again, there's laws and regulations that help protect the consumer, that requires consumers receive certain information so that they will be able to make, again, the best informed choices and decisions about their care. And I already alluded to the Joint Commission, or the DMV, I think it is, that Carl has now, that does their accrediting, as well as the magnet. But the nurse needs to understand and assess the patient's level of understanding and be prepared to deliver information in a clear and proficient manner for that patient to be able to understand. And to be able to advocate for patients, nurses should really master good teaching skills so patients can learn and better manage their health care. And something that patients did not have 20 to 30 years ago, many of them, is the internet. So patients now have a lot of access to a lot of different information, but whether it's true or not. So as an RN, that's one of the things that we need to hopefully be able to go over with our patients, being able to filter out maybe information that isn't as trustworthy, for information that the patient can be sure that they can trust that site, with giving them things that they can do to help manage their disease, whatever that may be. So and again, a good RN education helps the patient to remain autonomous and to be able to make those decisions with regarding their plan of care, so that they can have the best plan of care and understanding that plan of care, and also then how to make changes if they need to and who to notify. So the RN is also constantly evaluating the patient's level of understanding and modifying the teaching plan so that we can be able to achieve those outcomes, which is very important. So process principles of teaching and learning. When you learn or when you teach that patient, there should be a change in their behavior that occurs. Advocate, you promote an idea, belief, or person, and you are able to put somebody in the best possible position to assist himself or herself. And the basic assumptions of learning are: individuals choose to learn or not to learn. What the individual perceives as important is more readily learned. Multiple methods of presenting information will increase the likelihood that it will be retained. That's really important that you remember, is try not to go into a patient's room and teach them 15 minutes of how to administer insulin, how to check their blood sugars. That's too much for any one patient to be expected to be able to learn and to be able to return, demonstrate, and remember it for later. So we need to be looking at the times that we are educating, and also not doing it in just one big educational moment. We want to make sure that our patients are successful in what they are learning. So patient education is so important too, because it is directly related to the patient's ability to manage their own health and comply with the care plan and improve outcomes. And the RN, again, is an advocate for teaching patients how to best manage their care and provide correct information about treatments and options for better outcomes. And there's also theories that talk about, the importance of a patient's understanding how to do things and how to have good self-care, such as Virginia Henderson and Orm's theory of self-care. Self-care is very, very important, and I believe it will be continuing to increase in importance due to the burden and the cost of care. Self-care can save millions of dollars for the U.S. healthcare system. So it is important that we empower our patients and give them the information that they need so that they can continue to provide their own care. So basic principles of learning: a student's prior learning will either positively or negatively impact new learning. How students bring together information will influence how they are able to apply that knowledge. a student's motivation to learn is paramount in the process. If a student is not motivated to learn or doesn't understand why it is they need to learn something, then they're probably going to be less hesitant. They're probably going to be more hesitant to trying to learn something. So motivation is really key. Practice paired with concurrent feedback is critical to the quality of the learning process, and the student's current level of psychosocial development, interacting with environmental factors, all impact teaching. And to develop mastery, students must understand each part of the skill. This is an example, like a nursing skill. Be able to practice the skill in part or as a whole and understand when the skill is necessary. Carnegie Mellon's basic principles of learning should be considered when educating patients. Self-direction, motivation, and feedback influences the learning process. And being a better self-directed learner is a process that requires the ability to self-monitor and adjust the approach to learning. And active learning facilitates the learning process, whether you are learning as a student or teaching your patients. The more they can be active in their learning, then the more they're going to remember it, which is, of course, what we want. We want our patients to remember as much as what they can about what it is that we are educating them on, as well as we want you all to understand and remember as much as what you can. And so being an active learner in any teaching moment is really provides the best amount of learning for a patient or a student. So again, you want to assess your patients, how they learn the best. Do they understand what they need to learn so they have the motivation to learn? And you also want to be careful about judging patients. Just because somebody maybe doesn't have the motivation to learn doesn't mean that they will be non-compliant with the treatment plan. You as a nurse need to make sure that you understand and give the patient what it is that they need to learn and understand why they need to learn it so they're motivated to learn that. So it is really important that they understand why they're being taught what they are. So again, anxiety can be a barrier to learning, and so you want to make sure that you choose the educational time when the patient hopefully is having their pain under control, and hopefully with the education, the anxiety level can be decreased so that they can learn more. And ask them how they learn the best. Some people learn better by just hearing. Some people learn better by looking at a video or watching TV, while others may learn better by actually if it's something that they can do and return demonstrate. So again, so just education of our patients is just very important. And of course, you always want to make sure that you're documenting what you are educating them on and whether the patient verbalized understanding or return demonstrated, or whichever it was, how you were evaluating if they learned. So more facilitators of learning is the patient is motivated to make a change in their life. They understand. The patient believes that the information will be learned will be beneficial. The patient believes that it's possible to learn what is needed. Patient has clear and reasonable outcome objectives. The patient has a low to moderate level of stress. The patient has had other immediate needs met, such as pain control. If they're thirsty or hungry, they have done that, so they're maybe not thinking about eating while you're trying to educate. The patient has had or believes that the changes related to learning will have a positive influence on their life. And of course, the other thing you want to make sure that you are doing as well when you're educating your patients is you individualize that education. Different patients have different experiences, priorities, levels of understanding, as well as previous knowledge, attention span, and memory. If you do have somebody that has a short attention span or has some memory or cognition issues, that's when you want to make sure, number one, that you divide up your educational sessions up into more smaller chunks of time, but also make sure that their family member or caregiver can be with them while they are receiving the education. That way you have a backup, so if the patient doesn't remember, hopefully their caregiver will. And again, just break the education up in different sessions. Too much in one session is that the patient's not going to be able to, the patient won't be able to remember if you kind of go overboard. So you remember that. Okay, and then also facilitators of learning is the patient. Oh, excuse me, I've already said that. Okay, so adult learners prefer to be self-directed in learning, or at the very least have a say in their learning. And there are, of course, many differences among individuals that broaden with age and experience, and particularly life experiences. And adults seem to learn the best when they can relate their learning to their past experiences, and of course will then be more open to learning that hopefully more fulfills their needs. And adult learning theories, again, state that adults like to learn what they need to know to help solve a problem. They want to learn what is useful to them right now. They want to learn how and what they can be applied to their lives. And they don't really have use for information that is not really readily applicable. They like to choose what topics to learn about, and which is important. If you are educating on something with regards to their disease process, just ask them, hey, is there one particular element or something about your illness that maybe you're not understanding as well that you would like more education on? That way you know how to base your education on, and maybe what to spend more time with regards to what they feel like is the most important thing that they want to learn about. So that's important. So, assessment of readiness to learn, readiness for learning must be assessed before beginning the education process. And of course, like we said, you want to understand their stressors. Stresses on the patient will influence the patient's ability to understand and remember new information. And again, like I said, you want to try to include the family and the caregiver in the learning process. And always you want to assess the patient's current level of knowledge. And again, stressors, of course, will affect the patient's ability to understand, remember, and apply new information. So uh, make sure the healthcare team considers alternative teaching and learning strategies, and having family members and caregivers available as well. And again, making sure that you're giving them enough time to be able to learn, and breaking it up into different educational sessions is also certainly helpful and beneficial. And the education will help empower the patient to be an expert in their own health care. So, a question: a nurse is preparing to teach a patient, which behavior by the nurse is most accurate for implementing the teaching plan? And it's two, assessing the patient's knowledge before teaching. That way you know exactly where the patient's coming from and what they have understood and what they haven't understood, so that you can base your education upon that, which is always a good idea. Okay. And evaluation of effectiveness of learning. Of course, we want to do the education, but then we need to evaluate how effective was the learning. So the RN verifies that learning, not just teaching, has taken place. For learning to have occurred, the patient must incorporate the learned behavior into his or her life, or verbalize at least how they're going to do that. The patient's learning is often assessed at the time of teaching, yet an assessment done a day or two later or several hours later may better indicate the patient's retention and incorporation of new information or behavior changes. So remember again how we write interventions and outcomes. Interventions are RN-centered with teaching. Outcomes are focused on the patient learning. So again, there has to be some type of demonstration that learning has occurred, so that you know that they have retained something that you have educated them on, such as demonstrating the task or demonstrating the dressing change or maybe an IV med. And again, documentation has to be objective. Say what you did, state what the patient did, how and when, and that sort of thing. So that's important. Evaluation is always important too. And legal implications: standard of care dictates that patient teaching includes information regarding both the disorder as well as, of course, the treatment plan. The RN must be aware of the learning needs of the patient and provide a plan of care that will meet those needs. And then, of course, like we said, demonstration of learning is also required. So an example would be the RN teaches the patient's spouse how to do a wet to dry dressing on an abdominal surgical wound. This, of course, could take several days, since they will watch you do it while you explain each step the first time. Then they will become increasingly involved in doing with less and less direction. So also many times home health is ordered to follow up after discharge to assist with the first dressing change, and then reinforce and reassess the teaching and if the patient understands. So again, demonstration learning takes place when the patient is observed completing a task without complications or consequences. A return demonstration of a procedure one time does not mean the patient has achieved understanding. Document what you did, what the patient did, how and when. And again, documenting the learning process and using factual information about the observed learning session is important. Knowing that the patient truly understands may be impossible, but documenting the teaching process and the patient's response will provide factual evidence of the teaching session that has taken place. And follow-up after discharge, another method to evaluate effectiveness of patient learning may be the call system. The patient receives a telephone call from the RN 2 or 3 days after discharge, and then the RN will assess the patient's condition and the need for further instruction. So not sure really how many departments do this. I know a lot of times, I think surgery will do this maybe. We'll call, and maybe, I'm not sure whether expanded care, possibly expanded care, or yeah, maybe we'll do that after the patient has been in, or convenient care. Um, I'm just not sure about all the areas that have, that do that, but certainly you need to have somebody assigned to that if you do, and they need to be given the time to make sure that they have the time to make those phone calls to the patient. So, and as an RN, you complete your assessment, which includes a psychosocial assessment, and this is where some of your information will come from, but you need to continue to gather information throughout your relationship with the patient and family, which is how you individualize the teaching plan, which again is very important that we individualize not only the teaching plan, but the patient's care plan, right? So, so as teachers, we want to gather relevant information about the patient and their families and allow that information to guide the development and the educational plan. And in order for the teaching to be effective, you need to start with determining the learning objectives, figure the appropriate assessments that will evaluate associated learning, and choose instructional activities that best suit the need. I apologize if I just said that, but basic principles of teaching: be clear with the patient why the teaching is required, prioritize what is critical, and again, the patients can only absorb so much each time. Patient families do not have the background or the knowledge to know minute details intuitively, and processes need to be broken down into the minute steps that make up the whole. So again, prioritizing what they should learn and teaching by priority is also a good idea. And being an effective teacher, we take on multiple roles depending on the need of the student based on the outcomes desired. And again, evaluation consistently asks for an evaluation of our teaching, the experience as a whole, so that we can improve the quality of the learning experiences for the patient and their families. So nurses' credibility, characteristics of a teacher, has the appropriate credentials and licensure, and is honest enough to fulfill duties to the fullest and best of his or her ability. As a teacher, you need to have confidence, and self-evaluate is also helpful. And you need to use clear and effective communication that is necessary for effective teaching, and using terms that the patient can understand, of course, is also very important. So again, credibility includes education, knowledge, both current and static, and personal example. And teaching practice, you need to have good interpersonal communication skills, and always self-critiquing can enhance teacher confidence and make sure that you're covering what you need to be covering and that you're doing it in the best appropriate manner. And nursing is one of the most trusted professions. Patients trust us to do what is best for them and provide accurate information. We have a high reputation to live up to. Credibility is not just your credentials, but also includes integrity. And when we don't practice what we preach, it hurts our credibility. And of course, confidence: if you fumble around for about what you're trying to say or second guess yourself, the patient will likely think that you don't know what you're talking about. So you want to definitely be prepared before you go into the teaching session, and self-evaluate and continue to hone and better your teaching skills. And again, working on good, clear, and effective communication is really important. So preparing the learning environment, you want to make sure that before you start the education that you're providing for privacy. You want to minimize the distractions and noise, be relaxed and interested, sit next to the patient, have the appropriate teaching aids available to you, and provide written material or pamphlets that the patient can read and understand. And also you want to consider the learning styles of the patient. So, and then question process of teaching patients and families. A nurse is preparing the learning environment, which nursing action is appropriate, and one is sitting next to the patient. You certainly don't want to turn the TV on or move the teaching to the lobby, particularly if there's a lot of people in the lobby, plus that's not providing for their privacy. And you don't want to hurry through your teaching because you don't want to tire out the patient.